Rabies is an RNA virus that's present only in mammals. Ontario has zero tolerance for rabies in humans, and rabies tends to make animals more aggressive and fearless. Bats are the highest risk of transmission to humans, and dog to human exposure of rabies is only usually imported from abroad. During an investigation of rabies, first it's important to review incoming information from Nexus, review all the details, get contact information provided, analyze the situation. So what type of animal was responsible? Is the animal available? Where is the bite and how deep is the wound? And was the bite provoked or unprovoked? And then based on that, we should be updating profiles on Nexus. Our next step should be contacting the victim and confirming the situation that we got from the notes in the previous step. We should review the procedure regarding rabies and animal confinement with the victim, and we should notify them that the animal will be confined and observed for 10 days to confirm that it doesn't have rabies. And based on that test, it'll determine whether or not the victim needs PEP. Another good thing to get from the victim is to try to get owner information of the animal. Now, next is to contact the owner, and we want to verify that the animal is in good health, and we need to explain the importance of the confinement for the health of the victim. It's important to get an email address as well and a confirmation of the animal's health. So we can either confirm the animal's health by visiting the animal's home in person, or getting a video confirmation. It's also important to get information about the animal's vaccination status. Next, we need to issue a confinement letter to the owner of the animal, and this is done once all the info is on Nexus, and Nexus can generate a letter for us, and then we can email or drop it off in person. After the 10 days, the confinement is concluded, and we need to get confirmation of the animal's health, and we need to notify the victim that the animal is healthy and there is no need for post-exposure prophylaxis of rabies. Now, if the animal is not vaccinated, we need to give a letter of vaccination. We need to notify the owner that it's necessary for the animal to get vaccinated, and a letter produced on Nexus gives the owner 2 weeks to get rabies vaccination for the animal. This is flexible, and if they don't comply, it can lead to enforcement, but it is rare. Animal confinement. To determine if the animal involved infected the victim with rabies, the animal must be confined for 10 days, because between 3 to 7 days before the onset of symptoms, animals can shed the rabies virus. During the 10 days, the animal must be kept in a manner that prevents them contact with people other than the household residents. They must be kept in a manner that prevents contact with other animals, and the animal must be kept on a short leash when going out, and the animal should not receive any vaccinations until after the confinement, and the animal cannot be released or euthanized within the 10 days of confinement. Euthanization is only approved if it's for humane purposes, and the PHI must be able to observe the animal. So, Rabies Prevention and Control Protocol 2023. So under Regulation 557, doctors, RNs, veterinarians, and police officers must notify public health as soon as possible if there are any bites from mammals to humans and any contact with a mammal with the potential to transmit rabies to the person. So during the investigation, public health has to investigate any notification within 24 hours, and public health must collect data for investigation. So some things to collect from the person exposed or the victim are their name, gender, date of birth, age, their address, phone number, and email, whether the person has seen a health care provider or not, and the name of the healthcare provider. We should also document the exposure incident. What's the date of the animal exposure? What animal was involved? What species? The location of the incident, and the location of the exposure on the body, whether or not the exposure was provoked, and the general behavior of the animal. Was it acting weird? Next, we want to get information about the owner of the animal, specifically their name and gender and contact information, so address, telephone, and email. We also want to collect information about the animal. What species was the animal, and what does it look like? What breed, what color, any markings, and general size. It's important to note the name of the animal and the age of the animal as well as its origins. Is it from a breeder, a rescue, or is it from a pet store? We will also want to know the length of time the animal has been owned, its travel history, previous contact with wild animals, is the animal able to roam unsupervised, and the animal's vaccination status against rabies. Next, let's talk about risk assessment during rabies investigations. It's important to know what type of incident happened. So, some things we can ask ourselves are, what's the type of exposure? Was it bat or non-bat exposure? Because bats are more likely to carry rabies and are the leading cause of human exposure to rabies in Canada. Location of exposure on the body. Rabies bites or exposure closer to the brain can lead to shorter onsets of symptoms in humans. Risk of rabies in animal species involved. Mammals are the only species really known to spread rabies. Presence of rabies in areas where incidents occurred. Rabies isn't common in Canada, but more common abroad. Animal rabies exposure. Travel history and vaccination status. If the animal is able to roam unsupervised, then it has a higher risk of being exposed to rabies and bites from wild animals. Pets from other countries may have contracted rabies abroad. Behavior of the animal implicated. Animals behave differently, and this can be signs and symptoms of rabies. Animals can be super aggressive when infected with rabies and will bite anything, including itself. As well, animals' faces can be droopy and they could tend to be very shy if they are infected with rabies. Exposure circumstances. If the animal is unprovoked, it can be a sign of rabies because animals will become fearless when they're infected. Rabies immunizations. It's important that the animal is up to date with a rabies vaccination, as this can be a prevention of spreading rabies to humans. So, another risk assessment is regarding the patient, or also just information to get from the patient. We want to know if they're from Ontario, and we want to know their weight so we can calculate the dosage of PEP required. Do they have rabies immunization status? And are they immunocompromised? As these populations may need a fifth dose of rabies vaccination. Animal management. So again, animals can shed the virus 3 to 7 days before the onset of symptoms. If a human is exposed, we need to observe the animal to see if we need any PEP. So for dogs, cats, and ferrets, we need to wait 10 days for confinement. For livestock, so farm animals or horse, cow, bull, steer, calf, sheep, pigs, or goats, the confinement time is 14 days. And for exotic pets, confinement time should be consulted with the ministry. During the observation, animals should not be vaccinated for rabies or euthanized. During observation, if the animal dies, the PHI can test the animal's body remains for rabies, but we may have to balance out the emotional impacts of this testing. After confinement, Animals over 3 months old should get their vaccination status within 14 days, and animals under 3 months old should get their vaccination when they're at least 3.5 months old. If the animal was believed to have been in contact with the rabies or have contracted rabies, details must be given to the ministry, and any animal testing must be requested from the OAVT RRP. These people will come by and collect the specimen, which tends to be an animal head, and they should only be contacted once the animal is confirmed to be euthanized or has died. Rabies prophylaxis administration. So it is an Ontario publicly funded vaccine and should only go to Ontario residents exposed to rabies in Ontario or traveling abroad, or Canadian residents exposed to rabies in Ontario that need PEP in their home province. Non-residents in Canada must pay unless it's under extenuating circumstances, and PEP should be given as soon as possible. That being said, PEP can be withheld if the animal is sent for testing. If the animal is confined, PEP can be withheld pending the status of the animal during the observation period. If the animal shows signs of rabies, PEP should be initiated. The vet will see an animal to determine whether euthanization or submission for testing is warranted. If a test is negative, PEP can stop. If bites to neck, face, hands are severe, this can result in a shorter incubation period, and PEP shouldn't be delayed. Bites to neck, face, and heads are severe, but by domesticated animals that are fully vaccinated or provoked and in low prevalence areas, PEP can be delayed for observation. Again, PEP can be stopped if the testing determines no rabies, and other animals likely to produce exposure are raccoons, skunks, and foxes. So the Board of Health must report people getting PEP into IFIS, and suspected or confirmed cases of rabies must be immediately reported to the ministry and IFIS. So these are notes from the Management of Potential Rabies Exposure Guideline 2020. In Canada, the most common animals with rabies are terrestrial carnivores, so raccoons, skunks, and foxes, bats, cats, cattle, stray cats, or dogs. Rabies is less likely in domesticated animals because they're most likely vaccinated and spend more times indoors, and basically they're less exposed to animals that can potentially spread rabies to them. Human exposure to livestock is usually from contaminated saliva. However, swine and horses can bite. Risk of infection after exposure to rabid cattle is low. Small mammals like squirrels, rats, and mice are rarely found to be with rabies. Usually larger animals will infect them and they would die from the wound. Bats can transmit to these animals. Bat to small mammal to human has never really been documented, and PEP should only be given if the animal involved was behaving weird. So large rodents such as beavers and groundhogs, they can potentially carry rabies, but it is rare in Canada. However, the US gets some cases. Exposure to these animals, we need to consider the circumstances and location to determine if PEP is needed. So type of exposure, rabies is transmitted when the virus is introduced into a bite, wounds, cuts, or mucous membranes such as the eyes. So bite exposure, transmission is common through bat bites. Not bat bites, just bites in general. A bite is defined as the penetration of skin by teeth. Non-bite exposure, so this includes scratches, abrasions, cuts on the skin, or mucous membrane coming into contact with saliva or brain tissue. PEP is not initiated unless exposure involves saliva or neural tissue being introduced into wounds or mucous membranes. Petting rabid animals, contact with its blood, urine, feces, is considered an exposure. However, PEP is not warranted. Inhalation of aerosolized virus. So this is common with cave dwellers or explorers where bats can live, or in lab settings. Now, if the virus is inhaled through aerosolization, PEP is recommended. Exposure from caring for humans with rabies could transmit, but it's never really been documented, and PEP should be considered. So, bat exposure. PEP is recommended when both of these apply. Number one, there has been a direct contact with a bat, so a bite. A bite, scratch. So number two, a bite, scratch, saliva exposure to wound, or mucus cannot be ruled out. So direct contact with bat, bat touching or landing on person is direct contact. If there is no contact, transmission is extremely rare. A bat landing on clothing of adults. If there is a scratch or a bite, a PEP should be given. If a person cannot confirm, contact them. If a person cannot confirm contact, then PEP is not required. Bat direct contact with a child, PEP, unless we can rule out a bite or a scratch or mucus exposure. If a bat is found in a room with a child or an adult and confirmation of direct contact is difficult, especially with a child, if a bite were to occur, you'd most likely wake up and you'd have a bite mark. Do not capture a bat. Release bats out of the home or closed off area instead. Where the bat is, the window should be open to allow it to escape, and do not instruct people to capture or kill animals. It should only be done by wildlife professionals, and these professionals should be wearing PPE. And once the bat is collected and humanely euthanized, it should be submitted to OAVT. If a bat is positive, we must notify OMAFRA. Pets could also be potentially exposed to bat rabies. Incident investigation. Each incident must have a full investigation by the Board of Health. Any mammal biting a human or is suspected of having rabies should be reported. Any suspected rabid animals should be reported to the public health veterinarian. Virus in a wound must be taken up by a nerve synapse to travel to the brain where it causes fatal encephalitis. The virus can enter rapidly or remain on site before gaining access to the nervous system. More severe bites most likely suggest the animal is rabid. It's more opportunity for transmission to occur because of increased exposure to saliva. If bite is at a higher density of a nerve in a region of the body where there's higher density of nerves, this is an increased chance of developing rabies encephalitis. So examples of this are bites to the hand and face, because there are more nerve endings here in the hands or face, and bites are at higher risk because they have more access to nerve endings. Bites to the face and neck are at higher risk because they have more direct connections to the brain. Animal history. Is the animal acting abnormally? Has the animal had contact with wild animals or unvaccinated animals? Is the animal vaccinated? Unprovoked attacks are also another indicator that the animal is rabid. Rabid animals can also act uncharacteristically quiet. People feeding animals is a type of bite provocation. Provoked attacks should not be interpreted as a lower likelihood of rabies exposures. Trying to pick up a rabid animal is an example of a provoked bite, but still that animal would still have rabies, and it's still a exposure from a provoked bite. Sorry. It's important to note to never handle strays, wild animals, or domesticated animals acting weird. Domestic pets with up-to-date vaccination are likely to become infected with rabies. A vet should be consulted to determine if the animal is up to date with its vaccinations. A copy of the vaccination certificate should be obtained. A bite, regardless of vaccination history, must be followed up with public health. Dogs, cats, and ferrets should be confined for 10 days, regardless of vaccination status. If illness suggests the animal's rabid, it should be examined by a veterinarian as soon as possible. A vet is likely to, if a vet says it's likely to have rabies, the animal should be humanely euthanized in a way that preserves its brains. The head of the animal should be submitted to OAVT for testing. Confinement can take place in an owner's home, at a shelter, or at a veterinarian's office, depending on the reliability of the owner, capacity to keep the animal away from people and other animals. Those doing observations must notify public health if the animal does become ill or escapes during confinement. Unvaccinated animals that remain healthy after observation must be vaccinated afterwards. Stray or unwanted dogs, cats, or ferrets, they can potentially transmit rabies and should be observed. If it's not possible, the animal should be humanely euthanized and submitted for testing. If the animal escapes, we should try to find the animal and owner. If we can't, not enough information is available to analyze the risk of rabies in the animal, and we cannot confirm the behavior. So PEP should be considered by healthcare providers. Bats attacking with, cause, or hanging on a person tenaciously is an increased risk for rabies. Shedding time for raccoons, skunks, foxes is unknown, so these animals could potentially have transmitted rabies. Trained animal workers should capture these types of animals. They should be humanely euthanized and sent for testing. Livestock should be observed for 14 days. Exotic animals, their confinement days should be consulted with public health vets. Exposure to children can be difficult because the reports can be unreliable and hard to interpret. Management of people after an exposure. Objective of PEP is to neutralize rabies at the site of infection before rabies can enter the nervous system. Immediately clean and flush out the wound with soap and water to prevent rabies infection. A virucidal agent should be added to the wound too. Suturing the wound should be avoided, and tetanus shots and antibiotics should be given too. If exposure to rabies is highly likely, PEP should be administered as soon as possible. PEP can be delayed until tests from live animals are available, and the max waiting time is 48 hours. PEP can be discontinued if tests are negative. Exposure to wild foxes, raccoons, and skunks, PEP should be given. PEP should not be delayed even for waiting for test results. If testing results are negative, PEP can be stopped. For bat saliva or bat bite exposure, PEP should be started, even more so if it's in the hands, face, or neck. If someone touches a bat, if the bat is available for testing, we can delay PEP, but we can't delay it for more than 48 hours. If we cannot rule out that the bat bite or exposure to saliva occurred, then we must give PEP. When to give RIG? Healthy dogs, cats, and ferrets. A first indication of if we observe healthy dogs, cats, or ferrets, the first indication of rabies in the animal, we should give RIG and the vaccine to the victim. If the dog, cat, or ferret has escaped and is not able for confinement, the victim is advised to consult a healthcare professional regarding RIG and PEP. Dogs, cats, or ferrets suspected of rabies, we must give the RIG and vaccines. Same with any skunks, bats, fox, coyotes, or raccoon exposures. We should give RIG and vaccine right away. For livestock, we should wait out the 14-day observation period. For previously immunized people, RIG should not be given to someone if they had the rabies vaccine before. If exposure happens within 3 months of completing PEP, only wound treatment is required. So no rig or vaccine. And that concludes my notes on rabies.